Have you ever wondered why you yourself or another woman that you may know, that when they laugh or they cough or they sneeze, that they leak a little pee? And you just think that's normal because you heard that your mom does it, your grandma does it, your auntie, your best friend, and you just think that's a part of aging, not knowing that there are things you can do to fix that, like see a pelvic floor therapist, like talk to me, who's a pelvic floor therapist. So yesterday for Women's Day, I was invited to speak at an event which was amazing. There were chiropractors, there were nutritionists, personal trainers, and then there was also me talking about things, all about things that women can do to better their health, physically, mentally, emotionally. We even had someone guide us through a meditation. It was just a wonderful experience. So I recorded my lecture, my talk, on my DJI camera, my little camera. But it was like a quick setup because it was like after one speaker. I set it up, I put it on face tracking, but I guess somehow I lost my face and I did not know that. And in between me trying to control my slides and making sure that people could see my slides and speaking, so sometimes I'm out of the frame a little bit. I also, in the hurriness of setting up my camera, I recorded it in vertical instead of horizontal. And I was able to fix the frame a little bit, but you still can't see my body all the time. But anyways, the point is, the message is amazing. I go over pelvic floor basics, what normal peeing and pooping habits should be, what you can do to fix these things, the difference to know when you need to strengthen your pelvic floor versus relaxing your pelvic floor, depending on what things you have going on. The people asked amazing questions that you all may have, but I hope you enjoy it. Like and share it if you know someone that's having these issues, that you're like, I've been telling them there's a way to fix that. You don't have to live your whole life wearing pads and depends, because that's just not sexy, you feel me? So like, share, subscribe, follow, do all the things, comment. Yeah, enjoy.
So this is Dr. Matthew Carter. I know Mrs. Carter because Mr. Carter has been in her life since she was 15, 16?
Yeah, since 2015 we were dating, yeah.
So, very young. So, Mrs. Carter here, Dr. Carter, has been a very pivotal part of my life during my Shanti Mom training. She actually trained with me, which is amazing that I trained this doctor right here. But she knows anything and everything about pelvic floor health. And as women of certain age, meaner, we get a little older, I've come to ask her plenty of questions on why is it that when I drink a lot of wine and laugh with my girls, there's that tinkle. So I'll let her finish on that very portion of it.
It's an introduction.
All right. I struggle with the title. I was like, she said, do you want to come and speak? I was like, I never spoke before, but I was like, I need to make a slideshow because I love to talk about this stuff so much. I have to like keep myself on track. So if you're like, Lee, you're going down a rabbit hole, just go like this and be like, we don't know what you're talking about. Rabbit hole. Bring it on in. I won't be offended at all.
We're going down the rabbit hole.
We're going to be here all day. She was like 15, 30 minutes. I was like, I could talk hours about this stuff. I was like, I need to prompt some questions or something. Oh, goodness. So I named it When I Laugh, I Pee a Little, the silent struggle most women face, but no one likes to talk about. And I'm Dr.LeeLee. That's on my social medias and all the things. I have my business card out there. Y'all can grab it at the end if y'all like. So who am I? I have a lot of things. I'm a doctor of physical therapy, yoga instructor, prenatal postnatal yoga instructor, and certified doula, owner of Mama Stay Wellness, pelvic floor physical therapist. I'm currently working at a clinic in Springfield, seeing orthopedic patients and pelvic floor patients. I'm trying to, because Springfield's so far away. Hey, Natasha, can I see some patients here? We're going to talk about it.
Can.
Okay.
Afterwards, you want to go to dinner? You know what we get into when we go to dinner.
Right.
We'll be laughing and peeing.
Right. I was like, can I see some patients here? So there's a prenatal chiropractor in Dayton that she said I can rent some of her space. So I'm like, so I can just be a little bit closer to people on the weekends. I'm thinking about doing that. I'm also a birth doula. I'm taking clients starting in June. I have my May's calendar is going on. and I've been a wife for 6 years, and I'm a wonderful mom to my 19-month-old son. Yeah, it's been 6 years. It's crazy.
Wow.
So intro. Oh, I didn't do the thingy. Oh, well, y'all can kind of see it. There it go. So we're going to talk about pelvic floor health, bladder health, pooping, of course. A lot of women struggle with leaks, pain, constipation, but no one likes to talk about it. So we're going to cover what's normal, what's not normal, and what we can do about fixing it. So pelvic floor dysfunction, you're not alone. So I want you all to look to your left and then look to your right. Look at yourself. One of you will experience some form of pelvic floor dysfunction in your lifetime. 1 in 3 women will experience urinary incontinence, which is just a fancy way of saying leaking. 50% of women will have some degree of pelvic organ prolapse, and that's without pregnancy, without vaginal birth, just age, life. They'll have 50% will experience some form of pelvic organ prolapse. Nearly 40% of women experience chronic constipation, and 1 in 4 women experience painful sex or pelvic pain. So you're not alone. And the good news is, no matter what your age is, there's something you can do about it. So whether you never had children, had a child 40 years ago, or last year, we can work with you. We can fix some things. So functions of the pelvic floor. I got my pelvic floor model. I got so excited when she had her. I was like, oh, she got boobs too. Yes. Amazon. So functions of the pelvic floor, as you see, it holds your organs. So this is a bladder here. And then we have your uterus that it supports, as well as your anus here. And then you see it's a bowl here, and it's actually 3 layers of muscle. You have your first layer here, then there's like a fascial layer in between here, and then your 3rd layer here. So I was like, yes, it came into Amazon yesterday. I was so excited. So of course it controls urination in the fact of leaking, preventing leaks, complete emptying, controls bowel movements, preventing incontinence, helps elimination, affects sexual function far as pleasure and comfort, and helps with core strength and stability. It also has a role in the lymphatic system as well. It's not supposed to have a great role in core strength and stability, but a lot of times when our core is weak, our hips are weak, our glutes are weak, our pelvic floor says, well, we need to stabilize this pelvis, let's help out, and it tightens, and that can lead to issues too, and we'll talk about that. So pelvic floor throughout the year. So puberty, when we all start our periods, hormonal changes begin. It starts to influence the tone and flexibility of our pelvic floor. That's when our hips start to whiten a little bit. So that's going to change the lymph tension of our pelvic floor. Basically, our body's getting ready to potentially have a baby when we first start our cycles. Pregnancy, increased pressure on your pelvic floor because there's a baby on there. Hormonal shifts, and that can cause weakness or tightness with those changes. Postpartum, you're recovering from labor, either you had a vaginal birth or a C-section. The front layer of your pelvic floor is your abdominals. So if you have a C-section, we got to heal your pelvic floor because the baby was just on there on top of your abdominals that was just cut through. And the effects of a weakened core that can play a part in your pelvic floor as well. And then menopause and aging with lower estrogen, that leads to decreased blood flow in that area, weakened muscles, you have a prolapse risk, more urgency and frequency. And I like to add here, with the urgency and frequency, most falls happen because people are rushing on the way to the bathroom and they fall and break a hip. So yeah, so this is really important. And then, you know, when you get older and you have falls, you break a hip, it's like your life declines and all that stuff is bad stuff. So this is really important stuff to fix. So we're gonna play a true or false game. Scoot it over a little bit so they can see it. So just raise your hand if you think men do not have a pelvic floor. Good job, they do.
Never thought about it.
Raise your hand if you think everyone has stress incontinence after having a baby. Raise your hand if you think a good way to strengthen the pelvic floor is stopping urine flow while you're on the toilet. Raise your hand if you think it's okay to squat to urinate. You're in public, you want to touch the toilet seat, so you squat.
No.
All right. Urinating 9 times per day is normal.
No.
Who thinks that?
I hope so.
And a simple diet change can impact pelvic floor function. Who believes that?
Yes.
That is true. So let's see what we got right. Everything was false except for the last one. Men do have a pelvic floor. Not everyone has stress incontinence after having a baby, even though the conditions can set you up for having stress incontinence, but doesn't mean that you will. There's a good way. That's how we tell people to find their pelvic floor muscles, like how to begin to Kegel. We'll say, okay, sit on the toilet if you can stop the floor urine. Those are the muscles that we're trying to do, but we don't want you doing that every time you use the restroom because we don't mess up that reflex connection with the brain. When you squat to urinate, we want your pelvic floor to relax. When you're using the restroom, that's how people have incomplete emptying. So when you're squatting, you can't really relax your pelvic floor, and then that's why when people stand up and they dribble a little bit because you weren't relaxing all your muscles for you to have that full urination. Urinating 9 times per day is normal. It's not too off. 5 to 8 is what we want to aim for. We'll work on it. And yes, there are some diet changes we can do. We'll talk about a little bit in here. So common pelvic floor issues: urinary incontinence, pelvic organ prolapse, painful intercourse, and chronic constipation. A lot of times people just think of the urinary part, but when you have chronic constipation, that constant straining on your pelvic floor over time weakens it and causes issues too. So bladder health. So I said the 5-8 times a day. You're supposed to go every 3 to 4 hours. So it's not good to hold it. It's not good to go frequently either. 0 to 1 times a night if you're under 65, 1 to 2 times if you're pregnant or older. If you are going more than that, I tell people don't drink a ton of fluids 2 hours before you go to sleep, and you'll see a decrease in that. Don't just in case pee. It trains your bladder to be overactive. So of course it's like if you're about to go on a long trip or something, you want to pee before that. But if you do that frequently, it's like you're training you're supposed to like fill your bladder, it's full, then you pee. But if we keep doing this just in case peeing, we train our bladder that anytime there's urine in here, we got to get rid of it. And that's when people are peeing more frequently. So I have to like retrain our patients to say, wait till your bladder's full and then pee. Not every time you have a little bit of pee in there, you're eliminating it. Bladder irritants.
Something new every day. I see.
So these are things that could influence your bladder. Not everyone, but if you notice that you're drinking a lot of these things or eating a lot of these things and you're having problems, we also do a food diary and say, what are you eating that could be? I had a patient that she never drank water. All she drank was Diet Coke. And so she had a lot of overactivity, mixed incontinence, and it's like, think if you took a shower in Diet Coke, how would you feel? You would feel sticky, icky, like, get this off of me. It needs water to like cleanse itself. We need water to cleanse our bodies. So once we started taking away the Diet Coke slowly, I said, let's just back it down one at a time. And she noticed that her incontinence got a lot better. So caffeine, alcohol, acidic foods, even some acidic fruits like pineapple, carbonated drinks, spicy foods that can upset the bladder. Better options: water, herbal teas, pears, papayas, watermelon. Those are all safe foods to eat. There's like
I need to interrupt.
Go ahead.
So that means like soda water? I can't drink soda water?
Not that you can't, just not in excess.
Okay.
But if you notice that maybe that's the issue, try to back it down and see if that's improving some things. There's also medications that can affect your bladder. So I have, when we do an evaluation, I'm like, what medications are you on? Because they may already be on diuretics, which is causing them to use the restroom more frequently. Sedatives and muscle relaxers. It doesn't just relax whatever muscle you're trying, the bladder is also a muscle. So you're relaxing your pelvic floor, you're relaxing your organs, you're relaxing everything when you take muscle relaxers. So that can cause some issues. Narcotics, your Vicodins, your Oxys. Anytime people have surgery, we say, please take a stool softener because that's likely to back you up, increase your fiber, things like that. Antihistamines, Benadryl, that can cause urinary retention, a weak stream. And your antipsychotics like your Prozac, your Zolofts, calcium channel blockers, which is a type of blood pressure medication, it can make voiding difficult. So it may, if you like, okay, I've changed my diet, I'm drinking more water, and you notice that you're on some of these medications probably for a long time, and you may say, since they upped my prescription, I've been peeing more, I've been having some more issues. So that's a conversation you can have with your doctor to see if you can switch to something else. And we're going to talk about poop too. Just a little bit. So 1 to 3 days times per day is common. Every other day can be normal for some people, but not right, because we want to get rid of that toxins. Going longer than 3 days without a bowel movement, that is constipation. Also, the form of your poop, if it's like little bitty balls, that is constipation. Your poop should be soft, easy to pass, shaped like a smooth log. If it's hard, dry, or difficult to pass stool, that's constipation. And we said before, we don't want that. We want like type 4. We want the smooth sausage. That's what we want. We don't want it too watery, and we don't want little pellets either.
Okay,
Nutrition for the pelvic health. So increase your fiber, your leafy greens, your whole grains, flaxseed, beans, berries, hydration. If you're properly hydrated, it's easier for you to poop as well. Like she said, half of your body weight in ounces of water per day. People make fun of me because I have like a 112 ounce water bottle. They're like, you need to drink all that? I'm like, do you know how much I weigh? So yes, I do. And avoid processed foods. They slow your digestion, cause bloating. They're not good for you in general. So Kegels are not always the answer. This is a surprise for people because a lot of times they get this advice from their doctor. They're like, oh, you're having some type of urinary issue. Kegel, Kegel, Kegel. But your pelvic floor has to work just like any other muscle. It has to be able to fully contract and fully relax. And sometimes, like I said, if these other muscles around here are weak, the pelvic floor says, I'm going to help out with the stability, and it tightens. So if your pelvic floor is already up here and we're Kegeling, we're just tightening it more and more and more. And so think of this, you have this bowl like it's a trampoline. So if you're running, jumping, coughing, I can bounce on this trampoline because I have full range of motion of this muscle. If it's already up here and your trampoline is like concrete, as soon as it hits, if you put a water balloon on concrete, it's going to go everywhere. So that's why we need full relaxation and contraction of the muscles. So if people are having like pain, constipation, pain with intercourse, penetration, that's what I'm thinking. You probably have a tighter pelvic floor and we need to down train. So how to properly do a Kegel. A lot of times people do this wrong as well. They Kegel on the inhale. Scoot the thingy over so they can see the grandmother wish to call
Sorry, I apologize.
You're okay.
I'll get in trouble with Dr. God.
You're fine. You're fine. So as you inhale, it's showing that your lungs get bigger, your diaphragm pushes down, as well as your pelvic floor, belly pokes out. As you exhale, your lungs deflate, your diaphragm goes up, belly goes in, and so does your pelvic floor. So you kind of naturally want to go with what your body's already doing. So we're going to practice this real quick. So everybody close your eyes. Put your hands on your belly, and we're going to do that 360 breath that she talked about, when you're not just filling up the belly, but it's the belly and all 4 walls of the ribs, the front, back, and side. And when you inhale, I want you to really focus on that. You should feel your pelvic floor naturally drop down. Don't force it down. You should just feel it naturally drop down. And as you exhale, you should feel it naturally come up. So we're going to inhale for a count of 4, exhale for a count of 6. Close your eyes. I'll count you through. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Okay, open your eyes. Did you feel it? Mm-hmm. There you go. So you want to gently lift or engage the pelvic floor muscles on the exhale. Avoid holding your breath, over squeezing, clenching your butt. When people walk like this, it clenches their butt, and then they have tightness in the back of their pelvic floor muscles. So pressure management is good, better bowel control, and core strength. Pelvic floor relaxation. So since we're in a yoga studio, I said let's talk about the yoga moves you can do for the pelvic floor relaxation. So child's pose is a really good one. You can really do that 360 breathing, feeling the pelvic floor all the way go down, come up naturally. Happy baby, that's a good one. You're stretching out your hips, your pelvic floor as well. Deep squats like Malasana squats, butterfly pose, Baddha Konasana, and then the diaphragmatic breathing that we talked about. You can do that with all of those poses. if we need to strengthen the pelvic floor. So if the pelvic floor is weak, so I do internal exams, and if I go in there and I say Kegel and nothing's happening, and I'm like, okay, pretend like your vagina is a straw sucking up a blueberry like this, do this, and still nothing's happening. And I'm like, okay, we got some weakness going on. So, I forgot to say, well, I'll go back to that. But if the pelvic floor is weak, then you want to try like some hip bridges, bird dog, squats with pelvic floor control, tabletop. That's more like a Pilates move where you like have your feet up and you're like tapping down, working on your core, and then breathing coordinated with the Kegels. So connection between mental and physical health. So stress increases pelvic floor tension. Relaxation helps with bowel and bladder function. So try a guided meditation like we just did. Diaphragmatic breathing, mindfulness exercises. I find that people that have past traumas, anxiety, their pelvic floor tends to be a little bit tighter because they're just like this. So we got to work on down regulating them a lot. And I wanted to show y'all, there's something called a pelvic wand. So on top of stretching out the pelvic floor, sometimes, you know, you get like trigger points in your upper traps and it's like you get knots. You can get that in your vagina too. So it's really hard to reach there.
Really?
So we got a little tool. It's called a pelvic wand.
That looks like fun. With a G.
Yeah. So what it looks like, so say you notice when you're having any type of penetration intercourse that like it's tight on the left, you could take this little tool and just push on that, do like 5 deep breaths to ask, you kind of like ask like release, relax, release, relax, and that helps to get the tension out of your pelvic floor. Wow. Yeah.
So what about the balls? Like
what balls? The Kegel balls?
Yeah.
People shouldn't be using them. People shouldn't be using them. Yeah, people shouldn't be using them.
Yes, ma'am.
It's not functional because you don't need to pick up things with your pelvic floor. You just need to hold things. So long as
holds it, you're supposed to hold it in there.
yeah, but it's not meant to do that. I know what you're talking about. You're talking about Kegel balls. A lot of times when people like have those or like they wear them all day, it causes tension because basically like it's like if I had a weight and I did this all day. Some people do. They wear them like for hours, like thinking that's going to strengthen their pelvic floor, but it causes tension because it's like the same if I just had a weight and I walked around like this all day. My biceps not made to do this, nor is your pelvic floor. So when people are just holding stuff in there, it's like it wasn't meant to do that.
Take those out.
Yes, take them out. Take them things out. Take them out. She said, "Oh man."
What's that called and where do we get one?
A pelvic wand you get off of Amazon. Yep, or Intimate Rose. They even have some that vibrate. So women that are going through menopause, if you need more excess blood flow, they vibrate. Or like vaginal dryness, you can use the one that vibrates to try to increase the blood flow to that area. Yeah.
Yeah.
It's a whole thing.
We had this conversation before, especially drinking bourbon. I don't get it.
I mean, most people don't talk. I'm comfortable talking about poop and vaginas and things. Right. I was like, I'm comfortable talking about it, but most people don't like talking about that over dinner, but I don't care.
Bring one of those, I'd be like, hey, where's the wine?
Right. So your key takeaways. Yes. So key takeaways, your pelvic health impacts your bladder, bowel, and sexual function. Bladder habits matter. Don't just in case pee if you can help it. Of course, if you have to go somewhere, you know you're not going to pee for a long time, that's different, but don't like keep that as a habit. Bowel health affects pelvic floor, so eat fiber, stay hydrated. Yoga and movement help both strengthening and relaxation of the pelvic floor, depending on what moves you're doing, and Kegels aren't always the answer, so that's why it's good to talk to a pelvic floor therapist. I have free consultations. Y'all can go to my website and talk to me about it. And if you need to see me, we'll talk about it. And take action, like we were saying. I think everybody has the same theme of just small changes can equal big improvements. Like I said, sometimes it's just don't drink so much Diet Coke and we can make a change, or don't do this just in case peeing. Or like I had someone, she just held her pee all day because she was a teacher, and I'm like, you have to go pee because that's why you're having these leakage, because your bladder's like, I don't have anywhere else to put this stuff. So if you're only peeing twice in the day, yes, you're probably gonna leak, and she was doing that for years. So I'm like, I don't care. Leave them. Tell somebody to supervise the classroom, take names if they talk, go use the restroom. And that is my contact information. My business card is out there, and if you're fancy. So any questions or thoughts? What you got?
I got a lot. But,
Go ahead.
Well, we can save that for another time. But what about lower abdominals? I mean, how does that affect my pelvic strengthening and weakening?
It does. So this is my pelvis, and then my lower abdominals is like right here. So even though this is the internal structure, our outer walls of our pelvic floor is they say transverse abdominis. Your obliques play a part in there too. They don't really work in isolation. So I'll just say your abdominals, and then you have your hip muscles over here and your glutes. So all this plays a part. So if things are too tight, my pelvic floor is attached to some of those muscles and some of those muscle insertion points. So if my glutes are tight, the back of my pelvic floor can also be tight. Quick aside, I told you I was gonna go down a rabbit hole. So when pregnant ladies walk like this, they're clenching up their butt, they're not turning it on, it's getting weak, and then they complain that they pee a lot, and they think, oh, a baby's on the bladder. Well, yes, and if your pelvic floor is tight, your baby can't be back there. They're like, I don't have any room back here, so I have to be in the front, and so I'm gonna be more on your bladder, and that's why you pee more. But if you stretch out your glutes, and not just stretching out, because a lot of times a tight muscle is a weak muscle, so we got to strengthen it too, then your baby can be in a better position, and now on your bladder, you don't feel that urgency to pee all the time. I told you I was going to go down a rabbit hole.
That wasn't a rabbit hole. That was good. Thank you.
A big reason why we recommend pelvic floor PT with our prenatal clients to just work side by side makes.
Y'all want a pelvic floor therapist? I can come out on the weekends. Y'all want a pelvic floor?
I was gonna grab you.
Talk to me.
Say,
Okay.
We gotta talk.
Okay.
I was like, I'm ready to take.
I already love it that we're already empowering each other. So go pee.
Because I'm tired of working for real, like for other people.
Just saying, massages. I'm married.
I know, we gotta talk. I need a massage.
We all need massages.
Any other questions? No? Good.
Enlightened.
Awesome. And then there's a QR code if you want to go straight to my website. I was like, ooh, you can download free QR codes. I found that.
Yeah.
Go ahead.
I have, let's see, one teacher, a teacher, a social worker, another teacher, and all these people are saying, I drip all the time, I leak all the time. And they're doing all kinds of different things. I can't even remember what all they're doing, but one of them just had Botox injected into their bladder.
Okay. Are they going through menopause? Is that why?
Yeah, probably, yeah.
Okay.
But it's because she was peeing, dripping, just totally losing it one day in school.
Yeah.
So I don't know what's.
She should go see a pelvic floor therapist.
Oh, I agree. You know, your kids never listen to you.
That's why you have to tell one of their friends to tell them, and then they'll listen.
Yeah.
Do you find that it's been more women are having pelvic floor problems, and what do you think is the biggest cause of that?
I think I wish that after people had a baby, they just had pelvic floor therapy, because a lot of times that's where their issues stemmed from. Either they were having stress incontinence of some sort even while they were pregnant, and I'm like, it doesn't get better just because you have the baby. Like, the muscles still are the same. We have to strengthen them. We have to figure out what's going on.
Pregnant women in here, so y'all better listen up.
Also, I'm getting a lot of women that, because we've had like flu season and all that, they've been coughing a lot, coughing more than usual. And so that constant pressure. Also, when you cough, don't do this. Everybody's coughing and doing this, and they're sneezing and doing this. You're just putting more pressure on your pelvic floor when you do that. Also, people like to hold in their sneeze, just sneeze, just let it out.
Let it out.
Yes, just let it out, because you're building all that pressure inside and it's pushing on your pelvic floor. So I tell people, if you're leaking with coughing or sneezing, we call it a knack. So we say, okay, I know I'm about to sneeze, I know I'm about to cough. Try to do like 2 or 3 like quick Kegels, and then if you need to, do a little cross, because your adductors are connected to your pelvic floor as well. So I say do like quick Kegels, cross it, and then achoo, or cough, whatever. But don't do all the, because that makes it more pressure on your pelvic floor.
Do you always do an internal exam with all of your clients, or do you kind of just see
I would-
if you can make some improvements beforehand, or
I
you
would
always start
like
right
to. I have seen patients virtually, and is after like by what they're telling me, I can kind of guess. Like if they're saying, okay, I have pain with intercourse, I'm like, you probably have a tighter pelvic floor, and I'm like, well, where do you feel it? Is it on the left, on the right? That kind of gives me an idea what muscles we need to talk about. But some people are just super unaware of that area completely. They're just like, I don't know. They don't know how to do a Kegel. They're just so disconnected from that area. So I'm like, I need to do an internal exam because they're just giving me a bunch of, I don't know. I'm like, okay, well, I need to feel what's going on so I can help you. Yeah. But if people like really know their bodies and they're like, yes, I have these issues during this, or I can exercise, but I can't do this exercise, and I'm like, okay, by what you're telling me, I think these things are going on and we can figure it out. Or people, if they're not comfortable with the internal exam, I'm like, that's fine. Through my subjective, I can get a pretty good idea on what to do, and we can try some things that way. There's also an external exam. It's not my favorite, but you can like get to the muscles like in between her butt cheeks. But I'm like, you might as well just let me go in if I'm in between your butt cheeks. You might as well just let me go in.
Well, on that note, Mr. Thank you so much.
Thank you.
Stay here for a little bit longer if you have any more questions.
Yeah, I'll be here.
So thank you very much.